I'm Dr. Mohamed Rela. I'm one of the liver surgeons working in this country. I'm a surgeon working in Chennai in Global Hospital Group. Now, India has a large burden of liver disease. It's one among the countries where there is a high proportion of liver disease, particularly related to hepatitis B and hepatitis C viruses. And India has also got a large burden of disease due to fatty liver disease. There is a high incidence of hepatocellular carcinoma in our country. But in terms of treatment in the form of liver transplantation, India has taken a long time for it to be successful. I would say in the last 10 years, liver transplantation has become a reality, and now large number of liver transplants in the form of living donor liver transplantation is taking place in India. Where do we stand globally? Now, in terms of requirement for liver transplantation, we are still behind. We do around 1,000 to 1,400 liver transplants in India, if you take overall. The requirement for liver transplantation is probably in the range of 10 to 15 per million population. So we do need to do 10 times more liver transplantation if you really look at the necessity for the population. But however, we are really leading the world in terms of living donor liver transplantation. We are far behind in terms of diseased donor or cadaver liver transplantation. If you look at the number of transplants done in this country, more than 1,000 of these are living donor liver transplant. In the whole of the United States, there are probably only around 200 to 250 living donor liver transplants. So we probably do 4 times more than United States, probably 10 times more than what is done in the Europe. So, and we're probably doing as much living donor liver transplantation as, say, the Eastern countries like Korea and Japan. So we are really racing ahead in the competition for the technicalities of living donor liver transplant. In terms of the results of living donor liver transplant, we are actually now in par with the Eastern countries. In some respects, we are better than the Western countries. And hopefully we'll overtake everybody else, other than probably China, who might overtake us. The latest technical, that's the advances in liver transplantation currently come from living donor liver transplant. In the Western world, most of the advances are in terms of split liver transplant, sharing organs, preserving organs, and actually use of marginal organs and increasing access for the population for liver transplant. All of that is diseased donor liver transplant. Whereas in the East, all the developments, which are the high-tech developments, have come from living donor liver transplant, and India is in the forefront for those developments. The challenges are about access for the population. A large proportion of the population can't afford this treatment. The cost of liver transplantation is well over 20 lakhs. Unless the government undertakes to fund, this will not be accessible to all sections of society. That's the first problem. Having said that, I want to say that in the state of Tamil Nadu, a large proportion of patients are actually now funded by the government for liver transplant, and that needs to take place throughout the country. Then if all people who require liver transplant have to be funded, it's going to be a very expensive affair for the governments. So some form of funding needs to be done. Number 2, everybody who needs a liver transplant, even if they have the funding, is not getting liver transplant. Part of the reason is because we rely completely on living donor, and we have actually ignored or not done much effort for diseased donor, other than the southern states, Tamil Nadu, Kerala, and Maharashtra to some extent, and Andhra Pradesh have some diseased donor donation, and there has been progress made, whereas in the northern part of India, the eastern part of India, there's absolutely no cadaver donation. Unless cadaver donation improves, all patients will not have access to liver transplantation. And many families may not have a suitable donor, and what will they do? The future of living donor or liver transplantation is going to be having a combination of both diseased donor and living donor liver transplant. In our country, I think the numbers will increase. I will not be surprised in the next 5 to 10 years the number increases 5-fold or even 10-fold. That means we need to train large numbers of surgeons, and many hospitals have to come up offering liver transplantation in a cost-effective manner. But if you ask me what the long-term future of liver transplantation is, I have to say that we have to manage these patients without the need for liver transplant. There have been several breakthroughs in the treatment of patients with liver disease. The first now is the drugs available for hepatitis C. In most countries, hepatitis C associated liver disease or hepatitis C cirrhosis forms almost 30% of patients who need liver transplant. Now we have got a drug to abolish this hepatitis C completely cure this disease. That means 30% of the indications for liver transplant is going to disappear. So the necessity for liver transplantation is going to come down. Now there is also a lot of research on gene therapy. That means all metabolic liver diseases which require liver transplant now won't need liver transplant. And then there are now treatments available, or maybe artificial livers, and really what is called liver dialysis work is being carried out. They have not been so successful so far. If they become successful, then acute liver failure patients won't need liver transplant. So that means we are slowly conquering the treatment of medical treatment of many of the liver diseases, and as we conquer medical treatment, the requirement for liver transplantation hopefully will come down. Only a small proportion of patients, as we see today, will require transplant, and that is the future. So the future is not about developing liver transplant, the future is about reducing the need for liver transplant.